here that you can use to help you. But one is just have a basketball in your hand, just like this. And you're basically going to ulnarly deviate and rotate the basketball anteriorly, and then you're going to radially deviate and tilt the roll the basketball toward you. So there would be a point on the basketball right here. The basketball does not go down or up, it just rotates. So the point goes downward, back to neutral, or upward. Okay? I'm not pushing it downward or lifting it upward. I'm just rotating it. That's the first thing. Okay, so you got your hand skills kind of like that. The second thing is I want you to think of like a skewer. Like you might make, I don't know, shish kebab on. Shish kebab sounds good for Friday. We're actually having fish. We are. So, but right through is external auditory meatus, like right through here and out the other side. So you got that basketball. Now it's got an axis of rotation. So now I want you to kind of think about rotating that head along that axis. So it's a basketball with an axis, and you're rolling it, okay? You're not doing this. You're not flexing, and you're not extending, okay? How much motion was at the OA joint? Do you remember? 10, 15 degrees, not a lot, right? So if you're like 30, 20 degrees, you've blown by, okay? And we also know that it's a little bit more challenging for most individuals to get OA flexion, and we usually have less of it, and then it's a little bit easier to get OA extension, and we might have a little bit more of it just because of our posture. So far, so good? Okay. So now what we're going to do is this. We're going to go back to that mechanics lab and say, if I take the person's head and I'm holding it like this, and I roll them anteriorly, okay? You guys remember this? Well, if I roll them anteriorly, which way are their condyles going to glide? Posteriorly, okay, right? So, and then if I do this, roll them posteriorly, they're going to glide anteriorly, okay? So that's that basic premise. So we're just evaluating what that roll glide is in this joint. And so most of you will have normal motion here. And when we do this, again, both condyles are going back, the occipital condyles are going dorsally. Now, so the first thing I want you to do, grab someone's head, keep their head on the table. You're going to want to come here on the occipital, well, you know what the occipital protuberance is, right? Okay, come down, and then you have your supranuchal line here. So you're just kind of grasping there, okay? You're not really getting down onto the atlas right now or the axis, just grabbing the skull, really. The other thing is these other fingers, you can put them on the temple or you can put them on the head like this, but don't give them the earmuffs, okay? And then do this. It feels like it sounds like a storm, doesn't it? So try to keep off of their ears and don't cup them, and just back and forth. Now, what I'm really asking you to do now is to feel your end feels for OA flexion and extension. That's really what I do. I want you to take out the slack, and you're going to feel an end feel, and it's going to be definitive on flexion. Then you're going to go ahead and check your end feel for extension. But what's going to happen is when all your slack's up in extension, what do you think starts to extend easily? The lower cervical spine. So you got to be aware of how much rotation is going on there. So I want you to feel flexion to neutral, just generally, and then I want you to try to feel some extension, and then you can go through the full range, flexion to extension. That's all I want you to do right now. Just get your hand skills down, where to hold somebody. Don't give them the windstorm. Go through the movement. Think about the basketball and the axes, and then we're going to take it from there. Okay? Quality and quantity of motion.